Well, let's stay with that story. The situation is getting worse. That report suggesting that we're all going to be, or at least half of us are going to be obese by that time. 10 years earlier than previously expected, says this latest data. Health experts are calling for urgent action to tackle the problem. So let's talk to one of those health experts. Live to our central London studio, the consultant gastroenterologist, Dr. Jude Oben, is with us. Doctor, thank you for being here. How urgently should we be addressing this problem in 2014?
Very urgently indeed, because the Foresight report that you refer to said that the half the population, half the UK population will be obese by 2050. Our worry is that we're going to reach that number before 2050. If you come to my clinics at Guy's and St Thomas's Hospital on a Wednesday morning, the clinics are stuffed full to the rafters with patients with liver disease secondary to obesity. There is nothing being done presently by the present government to address the problem. We are scared that we're going to reach this horrendous number before 2050.
What should we be doing? What could we be doing?
I think the government needs to be much more aggressive in, the marketing of the downside or the negative effects of obesity, rather like smoking. And even with smoking, we didn't have half the population smoking, and yet there was an aggressive campaign to persuade the public to reduce its smoking levels.
So you'd actually put a government health warning on fatty foods saying, are you sure you want to eat this?
No, I don't think it needs to come to that. But people need to know, the public need to know that obesity kills. Obesity causes liver disease. Obesity causes liver cirrhosis. Obesity causes liver cancer. Obesity is involved in causing cancer of the colon, postmenopausal breast cancer, esophageal cancer, osteoarthritis, type 2 diabetes, heart disease. The list goes on and on and on. The public need to be aware of this so that when they go to their supermarkets or their fast food outlets, they can make appropriate, informed decisions.
Your experience then in seeing patients on a day-to-day basis,
yes.
Would you say this is a problem across the piece, right across social strata, across the wealth of the nation, or are particular groups particularly susceptible?
I think it's a cop-out to say that the problem is confined, if you like, to one social strata. It's a problem that affects everybody, and not just the adults, but more worryingly also the children. Therefore, we shouldn't focus our attempts on, if you like, non-ABC ones or ABC ones. It's across the whole social strata. But as I say, more worryingly are the children. Again, if you come to my clinic, there are 16-year-olds who weigh over 100 kilos. We need to do something. If we don't, these are going to be the people coming to clinic with liver cirrhosis, with liver cancer in the late 20s.
But when you put this concern to you, and I'm sure you're good at making the point to your patients, you know, you've got to turn your life around a bit here. Do they offer excuses? Do they offer logic? Because one anecdotal bit of evidence is, well, you know, money is tight and bad food is cheaper, and that's what fills you up. Is there any logic to that argument?
Allegedly, bad food is cheaper. I don't agree with that. I think my advice to my patients is that no food is bad for you. It's how much of it you eat that is bad for you. They need to be aware that the calorific requirement for a man, for a woman, is X or Y per day, that if you go above this, you're going to put on weight. And therefore, there needs to be a balance between how much you eat and how much exercise you do. And sure, my patients listen to me, but you're right, sometimes people do offer excuses. And what we need is a hard-hitting campaign along the lines of what I was saying before, that obesity kills, rather like smoking. And not only that, if you go, for example, to some stores and you have a look on the back of the foods, it tells you how many calories they contain. That is completely abstract. If I ask my medical students, how much exercise do you have to do to burn off 500 calories? Mercifully, they know, but my patients don't know. So telling them that this foodstuff contains 1,000 calories is completely meaningless. We need a campaign to tell them, by the way, if you eat 500 calories, it will take you approximately 1 hour on a cross trainer in the gym to lose this, because that way around it brings it real to them, rather it makes it real for them rather than a completely abstract 500 calories.
Dr. Jude Oben, thank you very much indeed for joining us this evening.
Thank you.